Have you ever sat quietly in the early morning, feeling the weight of years and memories, and wondered about the future? Maybe you've thought about your health, about the things that matter most as we grow older. For many men, there's one word that can send a shiver down the spine, one silent concern that creeps in during routine checkups or late-night conversations: prostate cancer. It's a word that carries fear, uncertainty, and sometimes stigma. Yet, it's also a word that science understands better than ever before. Today, we're going to face it together. We're going to answer 9 of the most pressing questions about prostate cancer, so you can be informed, empowered, and prepared. Because knowledge isn't just power, it's hope. Let's be honest, we spend most of our lives worrying about the big things: family, career, purpose. But as the years pass, the focus shifts. It's the small things, the everyday aches,
and the unfamiliar symptoms that start to matter. And when your doctor first mentions the prostate, maybe you feel a little embarrassed or confused. Maybe you try to brush it off thinking, that won't happen to me. But the truth is, prostate cancer affects nearly 1 in 8 men in their lifetime. That's not just a statistic. That's your neighbor, your brother, your father, your friend. That's you. Or it could be. So let's take this journey together. Let's strip away the fear and confusion. Let's answer the questions that keep you up at night. Let's talk about what science really says about prostate cancer, because you deserve clarity, truth, and peace of mind. Question 1. What is the prostate? And why does it matter? The prostate is a small walnut-shaped gland that sits just below the bladder in men. It's easy to forget about because you can't see it or feel it, until something goes wrong. The prostate's main job is to produce some of the fluid that mixes with sperm to create semen. But as men age, the prostate is prone to changes. Sometimes it grows larger, sometimes it becomes inflamed, and sometimes cancer cells begin to grow. Why does it matter? Because the prostate isn't just another organ. It's a gatekeeper for male health. When it's healthy, you don't notice it. But when it's not, you might experience urinary problems, pain, or even changes in sexual function. Problems with the prostate can be early warning signs of bigger issues. That's why understanding it and taking care of it is so important. Question 2. What causes prostate cancer? This is one of the toughest questions, and one that science is still working to fully answer. Prostate cancer starts when cells in the prostate begin to grow uncontrollably. But what triggers that? For most men, it's a combination of factors, a blend of genetics, age, and environment.
Age is the biggest risk factor. Prostate cancer is rare in men under 40, but the risk rises sharply after 50. If you have a father, brother, or son who's had prostate cancer, your risk doubles. African American men are also at higher risk, and scientists believe this may be due to a mix of genetic and environmental factors. There's also some evidence that diet, lifestyle, and exposure to certain chemicals can play a role. Diets high in red meat or dairy, low in fruits and vegetables, may increase risk. Obesity and lack of exercise don't just affect your heart, they affect your prostate too. But here's the truth: most cases have no single cause. Sometimes, cancer just happens. It's not anyone's fault. It's not a sign of weakness. It's biology, plain and simple. Question 3. What are the symptoms of prostate cancer? This is where things get tricky. In its early stages, prostate cancer often causes no symptoms
at all. That's why regular checkups are so important. But as the cancer grows, it can start to press on the urethra and bladder, causing symptoms like difficulty starting or stopping urination, weak or interrupted urine flow, frequent urination, especially at night, pain or burning during urination, blood in urine or semen, painful ejaculation. Some men also experience pain in the lower back, hips, or pelvis if the cancer has spread. But remember, these symptoms aren't exclusive to prostate cancer. They can be caused by benign prostatic hyperplasia, BPH, infections, or other conditions. The only way to know for sure is to talk to your doctor and get tested. Question 4. How is prostate cancer diagnosed? Diagnosis starts with a conversation, a chat with your doctor about symptoms, family history, and risk factors. From there, science steps in. The most common test is the PSA test, which measures levels of prostate-specific antigen in your blood. High PSA can mean cancer, but it can also mean infection or enlargement. If your PSA is high, your doctor might recommend a digital rectal exam, DRE. It's uncomfortable, but quick. The doctor checks for lumps or hard areas on the prostate. If anything looks suspicious, you might need a biopsy. Small samples of prostate tissue are taken and examined under a microscope. Imaging tests like MRI or ultrasound can help pinpoint problem areas. It's not always a straight path. Sometimes the tests are clear, sometimes they're confusing. But remember, a positive test doesn't mean you have cancer. It means you need answers. Science is there to help you find them. Question 5. Is prostate cancer always deadly? Here's some good news. Most prostate cancers grow slowly. Some never cause symptoms, and many never threaten your life. In fact, for older men, prostate cancer is often something you live with, not die from. The key is staging. Figuring out how far the cancer has spread. Localized prostate cancer, confined to the gland, has a 5-year survival rate of nearly 100%. Advanced cancer, which has spread to other parts of the body, is harder to treat. But even then, treatments are improving every year. Science has given us powerful tools, better drugs, targeted radiation, sophisticated surgery. Men are living longer, healthier lives after diagnosis. But early detection is the difference. That's why talking to your doctor, getting screened, and staying informed is so critical. Question 6. What are the treatment options for prostate cancer? Treatment depends on the stage of the cancer, your age, and your overall health. For early-stage cancer, doctors sometimes recommend active surveillance, watching the cancer closely with regular tests, but not treating it right away. This makes sense for slow-growing cancers in older men. If treatment is needed, there are several options. Surgery. Removing the prostate, radical prostatectomy, can be effective, but carries risks like incontinence and erectile dysfunction. Radiation therapy. High-energy beams target cancer cells. Side effects include fatigue, skin changes, and urinary problems. Hormone therapy. Drugs that block testosterone, which fuels prostate cancer growth. This can help slow the cancer, but may cause hot flashes, loss of libido, and bone thinning. Chemotherapy. Used mainly for advanced cancers, with side effects like nausea, hair loss, and fatigue. Newer treatments, immunotherapy, targeted therapy, and experimental drugs are on the horizon. The choice isn't easy. It involves weighing risks and benefits, talking with your doctor, and sometimes making tough decisions. But you're not alone. Science is on your side, and so is your medical team. Question 7. Can you prevent prostate cancer? Prevention is a powerful word, but in truth, there's no guaranteed way to avoid prostate cancer. Still, science points to some steps that may lower your risk. Eat a healthy diet. Focus on fruits, vegetables, whole grains, and lean proteins. Limit red meat, processed foods, and dairy. Stay active. Regular exercise helps maintain a healthy weight and balance hormones. Don't smoke. Tobacco is linked to aggressive forms of cancer. Know your family history. If prostate cancer runs in your family, share that information with your doctor. Get regular checkups. Early detection is your best defense. Some supplements and vitamins have been studied, like vitamin E, selenium, and lycopene. But there's no clear evidence they prevent cancer. Talk to your doctor before starting any new regimen. Prevention isn't about fear, it's about living well, making smart choices, and staying engaged in your health. Question 8. What happens after treatment? Life after prostate cancer treatment can be different, but it's often better than you think. Many men return to normal activities, work, and family. But there can be side effects: physical, emotional, and psychological. Some men experience urinary incontinence or erectile dysfunction. These problems can be embarrassing and frustrating, but treatments are available. Pelvic floor exercises, medications, and counseling can make a big difference. Emotionally, cancer is a roller coaster. You might feel relief, anxiety, or even depression. Support groups, therapy, and open conversations with loved ones help. Remember, you're not alone. Millions of men have walked this path before you. Regular follow-up appointments are vital. Your doctor will check for recurrence, monitor PSA levels, and address any lingering issues. Staying proactive is the key to long-term health. Question 9. What does the future hold for prostate cancer? The future is brighter than ever. Science is unlocking new treatments, better tests, and
deeper understanding every year. Genetic testing can help predict risk and personalize treatment. Precision medicine targets cancer cells while sparing healthy tissue. Researchers are exploring immunotherapy, using your own immune system to fight cancer. Artificial intelligence is revolutionizing diagnosis and management, making care faster and more accurate. Most importantly, awareness is growing. Men are talking openly about prostate health, breaking the silence that once surrounded this disease. Early detection, better treatments, and supportive care mean that prostate cancer is no longer a death sentence. It's a challenge, one that you and your loved ones can face head-on. Conclusion: if you're watching this and feeling anxious, overwhelmed, or uncertain, take a deep breath. You're not alone. Prostate cancer is a journey, but it's not a journey you have to walk alone. Science is your ally, and so are the millions of men who face this battle and come out stronger. Ask questions, seek answers, and lean on your loved ones. Life is precious, and every day is a gift worth fighting for. You've got this, one step at a time. Call to action if this video helped you. Don't keep it to yourself. Subscribe now, leave a comment about your experience, and share this with a friend who might need it. Your story, your questions, your support can make all the difference. Let's build a community of strength, hope, and resilience together.